When it comes to boys' health, routine doctor visits are often focused on common milestones, vaccinations, physical growth, and overall wellness. Yet, there's an important aspect of a young man's health that's sometimes overlooked: their reproductive and urological health. A first visit to a pediatric urologist, or even a general urologist, is a proactive step that can have lifelong benefits. But why does this visit matter so much, and what can families and young patients expect? From birth through adolescence, the male reproductive system undergoes significant changes. Early in life, some conditions may be present that aren't immediately obvious. For example, undescended testicles, hernias, or even subtle differences in anatomy might not cause symptoms, but can quietly impact future fertility or health. A first urologist visit is a valuable opportunity to screen for these issues before they become concerns. During infancy and early childhood, the most common reasons for a urologist visit include undescended testicles, hydrocele, a fluid-filled sac around a testicle, or hypospadias, a condition where the urethra doesn't open at the tip of the penis. These issues are not only treatable, but early intervention often leads to the best outcomes. For instance, correcting undescended testicles before the age of 1 has been shown to improve fertility prospects and reduce the risk of testicular cancer later in life. As boys enter adolescence, the purpose of a urologist visit begins to shift. Puberty brings a host of changes: hormonal surges, body hair, voice changes, and, most importantly, for reproductive health, the maturation of the testicles and penis. A urologist can help monitor that these changes are occurring on the right timeline. Delayed puberty, or early signs of puberty, can sometimes signal underlying health problems, ranging from hormonal imbalances to chromosomal conditions. Early detection means early management, which can make a significant difference in long-term health and well-being. A urologist also provides a comfortable environment for boys and their families to discuss sensitive topics, often for the first time. Testicular pain, swelling, or lumps can be alarming, but they are also treatable when addressed promptly. Testicular torsion, for example, is a sudden twisting of the testicle that can cut off blood supply and lead to permanent damage if not treated quickly. Educating boys about what's normal and what's not empowers them to speak up if they notice something unusual. Another important aspect of the first urologist visit is education about self-exams. Just as girls are taught to be aware of changes in their breast tissue, boys should learn to perform regular testicular self-exams. This simple monthly habit teaches boys to become familiar with their own bodies and to notice any changes that could indicate a problem, such as a lump or swelling. While testicular cancer is rare in children, it is one of the most common cancers in young men aged 15–35. Early detection is key, and self-exams are the first line of defense. For some boys, bedwetting or urinary tract infections are the reasons for their first urologist visit. While these issues can be embarrassing, they are also common and treatable. The urologist can assess whether there are underlying anatomical or functional issues that need to be addressed and help families develop effective management strategies. The urologist also plays a crucial role in discussing lifestyle factors that can impact reproductive health. Diet, physical activity, and even habits like bicycle riding or excessive heat exposure can influence testicular health. Boys who are involved in contact sports may benefit from learning about the importance of protective gear to prevent injuries. Open conversations about these topics, guided by a professional, help build a foundation for lifelong reproductive health. It's also important to recognize the psychological benefits of the first urologist visit. Adolescence is a time of rapid change, and questions about sexuality, body image, and function may arise. Having a trusted, knowledgeable adult who can answer questions honestly and without judgment can make all the difference. This reassurance helps boys develop a healthy attitude toward their bodies and addresses misconceptions before they can take root. For families, the first urologist visit is a chance to ask questions and alleviate concerns. Many parents worry about what's normal and what isn't, and hearing directly from a specialist can provide peace of mind. The urologist can explain normal anatomical variations, discuss what to expect during puberty, and provide guidance on when to seek help. This collaborative approach ensures that parents and children are partners in health. When should the first visit occur? The answer depends on the child. For boys with identified urologic issues at birth or in early childhood, the first visit may happen in infancy. For others, a prepubertal or early adolescent visit, around ages 10 to 13, can be a good time to establish care, particularly if there are no prior concerns. This timing allows for a baseline assessment before puberty is fully underway. For boys with family histories of reproductive or urologic conditions, such as varicocele, enlarged veins in the scrotum, testicular torsion, or genetic disorders, it may be wise to see a urologist earlier. The same is true for boys experiencing symptoms like pain, swelling, abnormal growth, or urinary issues. Ultimately, the first urologist visit is about prevention, education, and empowerment. By addressing potential problems early and providing information in a supportive setting, boys gain the tools they need to safeguard their reproductive health. It also helps break down the stigma and embarrassment that can surround male health issues, creating a culture where seeking help is seen as a sign of strength. In a world where health information is everywhere but often confusing, the guidance of a pediatric or general urologist is invaluable. These specialists are not only experts in their field, but also skilled listeners and educators. They help boys and their families navigate the journey from childhood to adulthood with confidence, ensuring that reproductive health is given the attention it deserves. Remember, the road to lifelong health begins with a single step. The first urologist visit is more than just a checkup. It's an investment in the future, laying the groundwork for healthy habits, open communication, and informed decision-making for years to come.